Hi everyone, welcome back. In this video, we will be covering signs and symptoms of HIV or AIDS. If you are new to this channel, consider subscribing, give it a like, share and comment. HIV. HIV is a virus that attacks the body immune system. If HIV is not treated, it can lead to AIDS. The only way to know for sure if you have HIV is to get tested. You can't rely on symptoms to tell whether you have HIV or not. Knowing your HIV status gives you important information, so consider giving HIV test to know your HIV health status. What are the symptoms of HIV? There are several symptoms of HIV. Not everyone will have the same symptoms. It depends on the person and what stage of the HIV they are in. Below are the three stages of HIV and some of the symptoms people may witness. For stage 1, acute HIV infection. About 2/3 of people will have a flu-like illness within 2 to 3 weeks after infection with HIV. This is the body's natural response to HIV infection. The symptoms can include like chills, fever, fatigue, rash, mouth ulcers, night sweats, muscle punks, sore throat, blown lymphums. These symptoms can last anywhere from some days to several weeks, but some people don't have any symptoms at all during this early stage of HIV. Don't ever assume you have HIV just because you have any of the above symptoms. They can be similar to those caused by diseases. But if you suppose you may have been exposed to HIV, get an HIV test. Stage 2, clinical latency. In this stage, the virus multiplies at low level. People in this stage may not feel sick or have any symptom. This stage is also called chronic HIV infection. Without HIV treatment, people can stay in this stage for 10 to 15 years, but some move through this stage faster. Still, if you take HIV medicines on every day exactly as specified, you can protect your health and have effectively no threat of transmitting HIV to your sexual partner. Still, you may transmit HIV during this stage even when you have no symptoms. It is important to see your healthcare provider regularly. Stage 3, AIDS. Ultimately, the HIV virus will weaken your body's immune system if you are not on treatment, and you will progress to AIDS. If you have HIV and you are not on HIV treatment, this is the last stage of HIV infection. Symptoms of AIDS can include like recurring fever, rapid weight loss, extreme and unexplained lethargy, prolonged swelling of lymph glands in the armpit, groin and neck, diarrhea for more than a week, sores of the mouth, anus and genitals, pneumonia, red, brown, pink or purplish blotches on or under the skin or inside the mouth, nose or eyelids, memory loss, depression and other neurological diseases. Each of these symptoms can also be related to other diseases. The only way to know for sure if you have HIV is to get tested. If you are HIV positive, a healthcare provider will diagnose if your HIV has progressed to stage 3, that is AIDS, based on a certain medical criteria. So these are the most effective information on HIV or AIDS infection. So if you find something informative on this video, please do consider subscribing to this channel. And thank you so much for viewing this video.